te vas a, a leer. Vos lo tenés, perfecto. Entonces pones publish. Espera. Vamos a decir acá. Ahí está, live video. Y ahí le das el start live. YouTube is already live.
Hello, everyone. So, is passport? Are we managing questions the same way? Or?
Yeah, I think so. No.
Yeah, let's put set up here. So let's here we are. Yeah, let's see. We are there. We are there. We are there. Good.
Let's do this.
Good. Si se apaga la compu, se cierra el coso. T es el password. T
No.
A mayúscula.
Perfect.
Okay.
Okay.
Live.
Hello.
I think we're all live. Start live video. Here it is. We are live.
I don't even know which camera to look at.
We're live in a few places: Instagram,
YouTube.
Facebook. What else? So we're gonna kind of look in the center right here.
Okay.
It includes all the cameras. So let's see. How's everybody doing? I hope you had an amazing week last week. We certainly did. It was fun. We actually went to med spa meeting, very interesting, and you guys are gonna be soon hearing about new med spa services like Botox fillers, in any sort of injectables, PRPs, microneedling, lasers in the future too. So that's gonna be something really nice that we're gonna be adding to our services. And so stay tuned because it's gonna be so fun.
Okay, we already have a couple of questions. Do we do abdominal etching? Yes.
All the time.
Yes, we do. We do it on females.
What
on
is
males.
abdominal etching for those that don't know what abdominal etching is?
Abdominal etching has different names. It can also be called high definition liposuction, high definition liposculpting. It essentially means etching athletic abdominal lines to give you the appearance, not give you the appearance, to make your abdominal muscles stand out more, like the six-pack in males, or in females. We can also do a six-pack, but mostly we do what's called moderate definition with the lateral lines and the line in the middle.
I call it the Victoria's Secret lines.
Yeah.
So
it's not just doing liposuction, it's actually sculpting athletic lines on your abdomen to make your abdominal muscles, more visual, more visualized, and it's a step above or beyond just traditional liposuction.
now we can also etch other muscles. So we can etch muscles on the arms, we can etch muscles on your back. So etching is pretty much a technique of high definition liposculpture where we actually take more defined areas of fat to create different, more defined contours. So that's what it is, and yes, we do it. And it's a great addition that you can do to your lipo, especially if you add J plasma. The J plasma will even improve the contracture of your skin and further improve the edging results.
Yeah.
So hold on a second. Here it is, the girl of the BBL. I'm in every single account now, huh? How could it get away? So
She's like groupie everywhere.
they told me that if I come a lot in camera and talk with you guys, I'll get a free BBL. What do you think, huh? Listen, you guys are asking if you can jump in the conversation. Of course you can. If you want to ask questions right now, take advantage. Both doctors are here. You can ask them anything. You can join us for the conversation. If you already got, you want to show your results, you got procedures done with them, jump in the conversation, we'll add you and you can show the results. Or if you have any questions, you guys, this is like a free consult.
That's right.
Hello.
Jessica.
Hi.
Hey.
Hey, I just had a quick question really quick. So I went to Mexico to go get a BBL and a tummy tuck, and I went live with you before with Dr. Miami, and on the ends of my stomach I have like where the stitches were, like it kind of pokes out a little bit, and I need it to be more flat into my skin. Is that possible, or is it too late since I've already got it done?
How long ago was your procedure?
I had my surgery June 8th.
So over 6 months. And you said
Yeah.
you have a little what?
So, do you want me to show you?
Yes, please.
Yeah.
Okay, hold on.
So you already had you had a BBL, you said, right?
I had Lipo 360 and a BBL and a tummy tuck.
Okay.
Okay.
And this is my scar, but do you see how it kind of like pokes out right here?
Yeah.
Oh, I see.
And then
Yeah.
also, not just that, but I have like right here, I have like loose skin.
Yeah.
Because when I did my surgery, I didn't know that you guys did like skin tightening. I didn't know about the J plasma at the time.
Right. Right.
And so I don't know if it would be too late to maybe tighten up that skin.
No, it's not too late. But let me ask you a couple of questions first. Did you lose a lot of weight before having this procedure, or?
I didn't lose it. No, that was another thing too. Is so I was 194 when I got my procedure done, and then after my procedure, because I didn't think that I was going to be able to lose any more weight. Now I'm at 168.
That's a lot of weight.
Yeah.
Yeah.
So that's over 30 pounds. So, well, first of all, it's, you can still have, it would be like
I'm sorry, you're breaking up. Can you repeat yourself?
Yeah, you can still have another procedure. You can it can be either a revision or a more fat removed or skin tightened. If it's been more than 6 months since your original procedure, you can have basically we can go back in and do more.
Yeah, if you do like a 360 lipo with J plasma, usually that will address both the skin laxity on your back as well as the little dog ears that you have in there. I don't think with that amount, you need to have anything resected again or removed. But lipo, the lipo will help both
Does there ever
things.
come times where like this kind of situation happens, and then to where like I would need to do another tummy tuck, or is that I wouldn't need? I'm just scared. I don't want to have another tummy tuck.
No, I don't think so. Your tummy tuck actually looks really nice, and I don't think you need another tummy tuck. But a lot of times doing lipo after the tummy tucks helps you further improve the results. We can create better definition, like we were talking about edging.
Because a lot of my butt, it died because of how much.
Then there you
weight
go.
That I lost after my surgery.
Exactly.
So now I have to do round 2 because I lost too much.
Well,
Yeah.
the round 2, that's a good idea. The round 2 would allow you to improve the booty because the fat transfer, but also to do the lipo that you need to correct both the little dog ears as well as the lipo of your back.
Yeah.
And doing J plasma is gonna help contract that skin on your back.
And that's what it's called, is dog ears. So when I talk to somebody, then that's
No,
what
well,
okay.
if you wait. If you talk to a plastic surgeon, you tell them standing cones. But to normal people, then you call it dog ears.
Okay. So I have a friend that she would like to get maybe some information too. Is that okay?
Absolutely.
sure.
Yeah.
Over to her?
Bring it on.
Okay. Louis, vente. He wants to talk to you. You can have Louis.
See, 2 for 1.
Right?
Hey, Luz, how
Hi,
are
how are
you?
you?
Hola, so yo me quiero hacer el procedimiento del Mommy Makeover.
Ajá.
Quiero quitarme, I lost a lot of weight y tengo mucho extra skin en mi estómago. And I would like to get a butt lift and some butt.
Okay. Y ya nos mandó una consulta online.
No, ¿cómo le haría?
Ok, el primer paso es que en la página de Instagram o Facebook de Top Aesthetics hay un link debajo del área que se llama Bio, y ese link lo presiona y la lleva a donde se hace la consulta. Ahí pone su información, su nombre, sube sus fotografías y de ahí nos llega a nosotros su consulta, la evaluamos con las fotografías, recomendamos los procedimientos que necesita y le va a llegar un email con un quote, unas recomendaciones y
Y el estimado del precio.
estimado,
Eso.
sí.
Can you guys maybe tell her, because I was trying to explain to her a little bit about the BMI. Can you maybe, would you guys maybe be able
Yeah.
to know what BMI is? If she told you how tall she is and how much she weighed, if she was good enough, a good candidate for the surgery?
See, perfect.
What's
See,
your height? Like, how tall are you and how
I'm
much do you
5
weigh?
feet and I weighed como like 185 right now.
105 5 feet. Okay.
Okay, hold on. Well,
Vamos a ver, ahora lo calculamos y te decimos cuánto sería, pero es probable que tengas es 36 tu BMI. Sí, deberías estar como en menos de 32, o sea que todavía deberías llegar como a menos de 160. Okay,
Yeah, because I'm in the process of losing weight. Pesaba 230 libras y ahorita estoy en 185, I think, probably a little bit less because ya los pantalones ya me quedan más mangos and I haven't weighed myself.
¿Cómo hiciste? ¿Cómo estás perdiendo peso? ¿Con cirugía o por tu cuenta? ¿Cómo hiciste?
On my own, just on watching and what I'm putting on my mouth.
That's awesome. That's the best way.
Yes.
Absolutely.
Let me
Good for
show you again about the consultation, okay? It's a lot of, so if this is Instagram, actually, let me put, hold on. Okay, this is the top aesthetics page on Instagram, see? I don't know, it's a little backwards, I don't know, but down here below the bio is the link. You click on that link, topaesthetics.info, and this shows up. And then you click here, the first button, and it'll show you how to get that's how you start the consultation form. Okay?
Yeah, fill that out, and we're gonna give you the recommendations of your weight, or if you're not at the weight, then we're gonna put a comment there. Your procedures are good, you can do this, and you need to lose this much weight. And if you're not, we'll give you can do certain things at this weight, and maybe sometimes patients that lose a lot of weight like you need more than one surgery, so they need 2 stages or 3 stages, depending on everybody's case. But just send your info, and we will be able to make a plan for you.
Okay, muchas gracias.
Okay,
De
bye,
nada.
ciao.
Okay, guys.
Thank you, bye.
Un placer. Bye-bye. So there you go. See, you guys can have consultations here with us.
Yeah.
That's an added. Okay, let's see. One more question. What do you say?
Okay, are we having any specials soon?
What is it? Is it, what is it? February 14? February, what is it?
Valentine's Day.
Valentine's, that's it. Maybe we can't tell you yet, but maybe.
All right. So we have comments. The coordinating team is amazing. Thank you. They are amazing. And one of my patients had surgery today and is feeling well. Amazing. Thank you. And I'm glad you're feeling well. All right. So what?
It's amazing that the patient just had surgery today and they're already alive.
Exactly.
That's not common.
So how can patients find out about prices? Because we have several questions about prices.
Yeah, so the best way to, we recently, if you go back in our feed in Instagram, you're gonna see the old prices and the new prices, that we recently increased. So if not, then you can always send your consultation, because the prices will vary. We have an amazing system that very quickly, within 24 hours, will give you the price just for you. Because it's not the same to do the tummy tuck on you that is in your friend. And it will be it's a tummy tuck as well, but the price might be different because what's involved for that tummy tuck is a lot more to, one or the other. So it's very important that you send us your information. We can give you like a general idea of pricing, but, I think it's best you have the chance here for us to give you the exact price for you, a quote. And our pricing, I'll tell you this, our pricing for the services that you will get in Top Aesthetics in terms of safety, comfort, care, besides the results, obviously, that, we know that we have great results. You won't find it. You might find cheaper, but you're gonna get cheaper other stuff too, including cheaper results. And with us, you're gonna get an amazing price, unbeatable price for everything we're giving you. So especially with the hotel stay and the care and the massages and the transportation, all these services that are included, that are mainly for your safety.
I think, the whole experience is what puts us, above everyone else, because many people just focus on the surgery, or, you go to a recovery home after that. But here we're incorporating every aspect of your experience from the time you arrive, where you're staying, who's taking care of you, your massages, your transportation to the clinic, the follow-ups. Everything has been thought about and incorporated into the same system, and that's what makes us different. So your whole experience is going to be better, obviously, in addition to having great results. All right, so can we do tummy tuck and BBLs together? Yes. How far apart? At the same day we can do them.
Yeah, we do a lot of times BBLs and tummy tucks. We do combination of procedure, triple procedures, do tummy tuck, BBL, breast, things like that. We are a practice that actually specializes in combination of procedures. Do single procedures, easy, anybody can do them. Do combination of procedures, very difficult. Very few people can do it. Especially how we do it, especially being efficient, do it in a safe way, but at the same time doing it in this shortest amount of time. So all of that, we have a beautiful setup that allows us to do that and also get good results, which is important. Very important.
All right. So were you gonna bring someone in or?
See if it's some people. Let's see what else.
Okay. What is J plasma?
What is J plasma? We have videos in YouTube that tells you what J plasma is. We have videos in Instagram, Facebook that tells you what J plasma. So, but briefly, what it is a skin tightening technology that uses radio frequency and helium gas to heat your skin while we're doing the liposuction right after, and then makes a collagen increase in your tissues that makes your skin tighter. So increases about 30 to 40% the result of your liposuction if you add the J plasma.
Yeah. So definitely worth it if someone has been pregnant, for example, and has some loose skin in their abdomen or back, someone that's lost a little weight, like the patient we were talking about earlier, that really adds on to their liposuction and improves your result. All right. So
yeah, somebody asked if we do blepharoplasties. Yes, we do blepharoplasties. We do facial surgery as well. So if you're interested in that, you definitely can.
And someone asked about facial lipo. We do a little bit. We do a lot of chin lipo, neck lipo. We go a little bit into the face. The face is not really lipo that much. You can remove the buccal fat pad, which is a fat pad we have here. We go inside the mouth and remove it that way. But it's not really lipo of the cheek so much. But we do facial procedures, chin lipo, and removal of the buccal fat pad. All right. Yeah, so Lauren, 6880, you're 12 days out from your tummy tuck and breast augmentation and swelling is increasing. Yes, that's normal. It'll continue to increase probably. Swelling after surgery peaks, believe it or not, 4 to 6 weeks after surgery. So very common to have swelling. You need to be patient and continue massaging.
Wearing the fajas.
Compression, and it'll go away. But very common to have swelling at this point.
Massages will help a lot with the swelling as well. Even though you might, at 12 days, you might not be removing fluid from your body, you're still stimulating the lymphatics to remove the fluid for you. And that helps a lot. That's the way it works.
All right, what else? What to do if you have a scar? Well, this question, scar tissue after BBL lipo 360. There are several ways to answer that. If you're talking about scar, like fibrosis under the skin, if you wait, it'll probably soften with time. Massages also help.
Massages help a lot. Cavitation helps a lot. Cupping helps. All these other technologies, sometimes ultrasound helps. You can do all of that and it definitely will help. But what it helps a lot is the time. Time will soften things down, and I think it will be definitely what is gonna ultimately improve your result. But if you can do other things like massages or other technologies, then your results or your improvement will be faster.
Yeah, carboxytherapy is another one that works. But all right, so let's see. Should you lose weight before a tummy tuck?
You should. It depends on where you are. But the best results for tummy tucks is when you are on your ideal body weight, which will be a BMI, I would say probably between 22 and 25. that will give you the best result. If you are on the overweight category, so 25 to 30, you have also a good result, but not as good as that one. If you are over 30, then it becomes a little bit more, you're on the obese category, so your result is not going to be as good as the results of somebody that is skinnier, just because you have more fat inside your tummy, more fat, more visceral fat. So that restricts us on how tighter we can make you, how small your waistline can be. So I always say, for your tummy tuck, try to get to the lowest you can be. Now, if you are, let's say, in the 28, 29 range, we do a tummy tuck and you lose another, 20 pounds, I will put you in the normal BMI, you're still going to look amazing, you know, and so you can lose weight after, but try not to be, over 30 if you're considering doing a tummy tuck.
Yeah. All right. So if you get lipo 360, do you still get liposuction of the back? Yes. Actually, with us, you get a little bit more, because most practices for lipo 360 only provide liposuction of the low back. Some practices include a little bit of the mid back. We include the full back from the axilla down to the buttocks. So you get lipo 360 for us means whole abdomen, waist, and then the whole back from the axilla down. It's another thing that sets us apart. It's all included in the same price, so it's a really good deal.
Let's do.
Okay. You wanna bring someone in, or?
I know there's somebody here.
Okay.
I'll give it now.
All right. You're having someone's having a thigh lift in March. How soon can they come back and get lipo 360 after the thigh lift?
I always say, if it's a different surgical site, you need to make sure you're healed from the previous surgery. So the soonest will be 3 months, until you are, pretty good and healed, that you can travel again and do things like that. If you're having surgery on the same surgical site, let's say you're having a lipo 360 and then you want a BBL, you want a tummy tuck, for example, or you're having a BBL and then you want a tummy tuck. We're gonna have to be doing surgery in the same surgical site, which is your abdomen where we did the lipo. In those cases, then you should wait a minimum of 6 months. Hopefully, maybe better if you wait a year. But for somebody that is doing, let's say, lipo of the abdomen and then they want the breast, which is a different surgical site, 3 months, be healed from the lipo, and then come back for your breast. Make sense?
Yeah. So just really easy. Different sites, 3 months. Same sites, 6 months to a year. It really depends. This is a very good question, actually. I don't think we've had this one before. So someone had circumferential tummy tuck, also called a belt lipectomy. That means that the incision goes all around on the waist, and they also had a breast lift, breast augmentation, but they still have some sagging skin in the upper abdomen. So what can be done? It really depends. It sounds like you're a massive weight loss patient. You've probably lost a lot of weight from, either just diet and exercise or having bariatric surgery, which is great for you. There's a couple of things. You could have, after waiting the amount of time we discussed, you can have a reverse tummy tuck, in which we use the same incision you had for the breast lift, and then take out that excess skin in the upper abdomen. The other option is to convert it to something called a fleur-de-lis tummy tuck, in which you get a vertical incision, and that allows us to take out more skin. But usually, if you have more skin, it just needs to be resected. We need to find a way to remove it. All right?
Yeah. There's sometimes if you do like an upper body lift, like what we call an upper body lift, which is a kind of a back lift with a breast lift, and you lift all that portion of the procedure, it actually addresses a lot of that upper abdomen. It's almost like doing a reverse abdominoplasty, that you can push things up. So in post-bariatric patients or massive weight loss patients, a lot of times we recommend to do the circumferential lift, BBL, do the midsection, and then come back for the upper body, which usually includes your arms, your breast, and your back, or this part of the, kind of this part. So that's the best approach, and that lifts things up, and then you already remove the things, lift your body, remove the excess in the center, and then you remove the excess on the top. That's the sequence.
Yeah, so we have actually we have a whole treatment plan for patients with massive weight loss surgery. It involves 3 stages, and it's part of a process, but you get great results and safely done too.
Yeah.
Okay, so What do we do when patients have drains? Can they stay here until the drain is removed? What do we recommend with the drains?
Yeah, well, we do drains mainly on the tummy tucks. We don't do drains in pretty much any other procedure. So that's one thing. If you are having drains, the drains is actually an easy thing. A lot of our patients, we just have them remove it, or we guide them through, FaceTime, how to remove it, or a friend can help them, or the husband, if they're okay with it, they can remove it. So it's not a big deal. First is that. It's unlikely that if you stay here for just 1 week, you're gonna have your drain removed, because usually it takes 2 to 3 weeks, sometimes even 4 weeks.
And
until
everyone's
it's removed.
different, I was going to say. Some people
Right.
can have it removed in 7 days, some people takes 10, 14, so it's not worth it to stay here waiting
Yeah.
for that.
And we don't know when it's gonna be. So, if you're gonna be here for a month, great. Then most likely we will get it removed. But if you're here for 1 week, we won't. The other things that people usually do is they go to the primary care, or they go to they have a friend that is a nurse and somebody that can help them, that are familiar with that. Some patients are getting massages in places, and a lot of these massage therapists are able to remove it for you as well. So there's many options really to have the drains removed, and it's an easy process. So don't sweat it. It's good. It's
Yeah.
not that bad.
So just a final thing, in order to determine when it's ready to come out, it's not the number of days you have it, it's the amount of volume coming out. And we want less than 30 cc's in 24 hours for 2 straight days. So you're gonna be measuring how much comes out, you log it on a piece of paper we give you, or in a piece of paper, and then when you hit that goal, regardless of what day it is after surgery, then it's okay to remove it.
We have videos about drains also in the YouTube channel. So if you want more answers, watch our quick videos, and we'll tell you everything you need to know.
All right, so we've talked about this already.
More questions. What else?
Let's see. Does a thigh lift help with a saggy butt after a BBL, or just the thighs? So,
The what?
yeah, it's like, does a thigh lift help with a saggy butt after a BBL, or just? I think it mostly just addresses the thighs. It really doesn't.
Thigh lift addresses the medial thighs. If you want to address the lateral thighs, so you have some saddlebags and some excess on the lateral thighs, then what you need is probably like a circumferential body lift. When you do the belt lipectomy that Dr. Morales was describing, when you lift the whole body, that improves a lot your booty and your lateral, kind of body, and then your lateral thighs. The medial thighs actually address the medial thighs. The thigh lift usually addresses the medial thighs. Which is a common area of concern on patients that have lost a significant amount of weight. So, yeah.
Okay.
See, we can bring somebody here. There are a few requests. What else?
So what are the limits? So what are the lowest and highest BMI? Okay, hi.
Nicole. Hello.
Hi.
Hey.
How's it going?
Good. How are you?
I'm good, Hero.
We're wearing your faja.
I am 2 weeks?
I know. That's pretty amazing. Look at
I
you.
think I look good.
You look great,
I
yeah.
just wanted to know when I should downsize the faja. Will it compress me more down here than?
Yeah. What happened with your foams? Are you still wearing them or not? No more?
I wear them, yeah.
Okay. Yeah.
They're not in right now.
No, that's fine. I mean, it looks pretty tight to me. So if you're wearing your foams, it's gonna be a little bit tighter even. But when
I just feel like it's really big.
okay, well then do this. I mean, I will definitely use your foams, and then you can put the waist trainer on top of all that until.
I tried, and then it just cut down into here.
And what happened? And what happened?
It was just like it was too much right here.
Okay. Well, you are kind of in that in between phase. I will probably use your foams for now, and then start thinking in getting a faja that is one size smaller, and then you should be able to fit in that pretty soon. So it looks amazing. I mean, you look awesome for this time.
Wait a second, Nicole. Sorry, did you get a BBL?
Pardon?
Did you get a BBL?
Yes.
Well, listen, can you show them to the kind of BBL that I want? I mean, you're like my wish pick. Look at this. This is exactly what I need. That's not going to be helpful.
But I still have some pretty bad bruising right on my butt.
Yeah, are you taking some arnica pills or arnica tea? You should probably just try to do some more arnica.
Oh, okay.
Yeah,
Okay.
that would
Let-
help a lot with your
Other than that,
bruising.
It looks really.
Let me see. Listen, I'll tell you this. That BBL is the dream BBL that I need. I mean, wouldn't that just be perfect?
Oh, she has an amazing body.
I'm not even
Yeah.
gonna turn around and show mine because I'm embarrassed.
You need to go eat first. Some,
But but then I'm gonna be. I have a big stomach with no butt. How ugly is gonna be?
but we need a little bit more. Yeah, so it looks awesome.
Oh wow.
And your waistline looks amazing.
Yeah, that
Oh my God! I need this, doctors.
looks
Can you please
amazing.
pay attention? Look at this. This is the BBL that I need.
Yeah.
I can't believe it.
But the red, really red.
Yeah, that's fine. That is pretty normal. You know, you can. Do you still have the arnica cream that we gave you or no?
Yeah.
So
I put
you.
it up here because I have bruising like right here.
Yeah,
but-
use that in those areas. You know, use that cream in particular because that is gonna target those particular areas. And you can also, on top of that, you know, just get a tea, an arnica tea, and that is gonna help a lot with your bruising. But you're, you know.
No,
your-
but Nicole,
with your-
you look
yeah, your
amazing.
neck
It's like
is-
I cannot believe how good you look so soon.
I always tell the patients, you don't look like your
And I
family
have
anymore, you know.
plasma on my stomach, so it looks like.
No, my God, no.
Yeah,
But
look
your
at your tummy.
BBL is like it's. I swear,
There
like
you
that's
go.
exactly what I need.
Remind me, have you had kids, Nicole, or not?
Yes, I have one. She's
That-
actually right here.
That's awesome, man.
Wow. Oh my
right.
God.
She's
I don't have a kid and I don't look as good as you two. Should I get a kid then?
No.
But no, like I can take care of her. Like I'm fine. Like I feel good. You know what I mean? Like
Wow.
I don't know if I'll be able to do it, but like I can do it.
Wow.
That is pretty
I'm
amazing.
flipping out, man. I cannot believe that BBL. Tonight I'm going to dream with it. That's exactly the BBL that I need.
Oh, one other question. Is it okay if I put like that Palmer's oil on my bum?
Yeah,
Like, just, like,
Which one?
Yeah, it's okay. It won't affect anything.
the oil.
Hmm.
Yeah. No, it will not. I mean, I imagine your incisions are pretty well healed and closed by now.
Oh, they're
so
shot.
yeah.
They're shot.
So then I think it's not gonna be an issue with that.
Okay, well, thank
No,
you.
you're amazing. You look amazing. You know,
Thank
we
you.
would like to take all the credit, but you know, you have amazing genetics too. You know, so
You better say that of me when you get it done of me.
Yeah.
Listen, Nicole, send a picture of your butt and I'll print it out and I'll put it out here, okay?
That's
Okay,
what-
sounds good.
She has a goal to work towards.
Okay,
You know?
Yes.
Thank
Good.
you.
Thank you, Nicole. See you soon.
bye.
No, very amazing. But you know, like again, we would like to take a lot of the credit, but obviously she has amazing genetics. She has a kid. Her body, she didn't need a tummy tuck. You know, she the BBL. So if you're in that stage, definitely a BBL will be more than enough, as you can see on her. Now, if you have a lot of excess skin or your tummy is stretched out, then in that case you might need a tummy tuck as well. But she looks amazing.
Amazing.
All right. So, what's the lowest and highest BMI we can do surgery on? So lowest, probably around 19, and it's usually on patients that need a breast augmentation or something like that. The highest we can go, sorry, is 40, and that's basically patients that want liposuction. That's all they can qualify at that BMI. But
Yeah.
so from 19 to 40, and then it depends on what procedure you'd like. You know, we'll evaluate you for that during your consultation. Oh, I'm sorry.
No, that's let's see. Let's see. Okay. What else?
All right, my surgery's in July. I am healthy patient. Any recommendations? What?
Yeah.
Any recommendations that I should add to my diet? For example, supplements. Oh, that's a good one. Supplements.
Supplements is definitely a good thing. You
Yeah.
know, when you do vitamins, when you are sure that your iron levels are high, that you're not anemic, all of that is definitely important. Make sure you around the surgery, right before and right after, you have a high protein diet, and you're taking iron and you're taking folic acid and you're taking the vitamins. So all of those things are definitely very helpful for your recovery. You know, so
Probably at least a multivitamin. Maybe try protein shakes, and well, that's like
Yeah.
the minimum, right?
But
And then maybe
there are your diet should include something that is away from a lot of fat and from a lot of like spicy stuff, because your stomach is not quite ready yet. So make sure that around your surgery time you are kind of a light diet if you can. And if you have to lose weight, well, eliminate the carbs. Carbs are very important to be eliminated. No alcohol, no carbs, kind of a boring diet, but you're gonna lose weight pretty fast if you really watch and eliminate 90% of your carbs. So that's what you guys can do to lose some weight.
All right, someone that is 7 months of post-op after a tummy tuck, can she have a BBL now? Probably yes. We talked about that. It's 6 months to a year. So yeah, probably after 6 months you can have one. Obviously we need to evaluate your pictures, so send us a consultation and we'll take a look.
Yeah, if you send us your consult, we can tell you exactly how it is and how you look and see if you're ready for the BBL.
Okay. So
what else?
With pregnancy, the muscles in the abdomen that make a six-pack, they separate because the baby's pushing those muscles out, and instead of being like this, they come apart. And so the tummy tuck fixes that by making those muscles come back to the middle and give you a flatter abdomen. But the question is, can those muscles be brought back together without a tummy tuck? Is there any other way to fix, the medical term is rectus diastasis, without getting a tummy tuck? And the answer is no, not really. The only way, because the muscles are separated and there's really nothing that's going to put them back together except going in and putting a suture that brings them together. Exercise will make your muscles stronger, but they will still be separated. And so there's, physical therapy, all of that, will help, but will not bring the muscles back together. So the only way to really fix it, a diastasis, is with a suture, which is a component of the tummy tuck. All right.
I agree with that.
Okay. Do our prices include the stay?
Our prices, no, we don't include the stay in the prices. But we'll give you the stay. It's for the hotel 7 days, 6 nights, transportation, massages, private care, and all of that is $1,500. Soon to be $2,000. So, if you are interested in not paying $2,000, then you should probably try to book soon.
So if you add every component of that, if you add the hotel, if you add how much massages cost, how much having a medical assistant with you costs for 30 hours, how much it costs to have breakfast for 2 people every morning, how much it costs to Uber from the hotel to the clinic, back and forth, I guarantee you that when you add everything up, that's going to be more than $1,500. Okay, this price is not what we're not making money on this, and it's to help you have a good experience when you come and have surgery.
But not only that, because when you stay with us, let's say that you find somebody for $1,500, and we monitor your vitals very closely. We get our assistants, your caregivers are sending us the information of how you're doing. If you stay somewhere else, if you stay at home or with your family or in a recovery home, we have no control of that. We have no updates, nothing. But when you stay with us, you are under our direct supervision. Not only that, but you don't have to come see me. We go see you at the hotel. Mm-hmm. So we go to the hotel, see you in the comfort of the hotel. You get the massages in the comfort of your own room.
Not even my boyfriend did that when I was in a hotel. And these people go and they sit there, and if you need them, they get your vital pulses like in their phone. They get your vital signs. Come on, you guys. This is not going to happen anywhere else. And you have the massages coming in all the time, and you have an assistant that is right next to you if you need anything, which a lot of you guys say, no, I'm going to be fine. It's just plastic surgery. Some of you, not all of you guys, maybe 50-50, need assistance when you're out of there. And sometimes the husbands don't know what to do. Honestly, I went to a room to interview somebody. The husband was taking a nap, okay? I was like, I'm just going to smack this person. So you want to be with somebody that's going to be there assisting you. And all this recovery of 7 days is enough time to get you out of the danger zone. But when you go back home, you're safe and you feel good. we strongly recommend it. I mean, look at these guys, okay? I mean, look at them.
Again,
Yeah.
it's about safety. It's about having a good experience. I mean, you don't want to be suffering through your recovery. You want to be sort of coursing through an uneventful recovery that's not too painful, where you have peace of mind, that you're being taken care of, that someone's there if you need to. You know, we know where you are and everything. Hello.
Hello.
Hello, how are you?
Tomorrow makes 4 weeks.
Amazing.
4 weeks already has gone by very fast. The first couple were a little bit rough, but not as bad as I had expected.
Tell everyone what you have done.
So I had an extended tummy tuck and a BBL. So part of that, the lipo.
Perfect.
I stayed in a hotel for the 7 days, 6 nights, because I came from New York. So New York down to Florida. Hotel experience, everything was great. Flight experience, okay, so I'm short. I don't know. As you see, and
Yeah.
I'm not.
That's awesome.
I had to go down a size, and this one even is on like the 3rd hook, and I have foams on all sides, so it's gonna either have to get taken in or go down another size.
Perfect. How soon do you 3 weeks? How soon did you went to another size?
I was put in a 4XL right after surgery. Like that's what I was sized with before. But after like the first week, it was very, very big. Even with foams and all of it, it was very big. So I went from 4X to an XL. And then this has been, the last few weeks in this one. Because I'm like, yeah, that 4X was way too big. But I can imagine, because, they fit it in pre-op. So
Correct.
all the extra belly hanging, it needed to be kind of big.
No, it's important, and we don't want it super tight at the beginning because we don't want it to
Yeah.
compromise the skin and all that. But you're making the perfect example of it's very unpredictable how, when, it varies from person to person, how fast the swelling goes down and all that. And in your case, sounds like you did it pretty quickly, so that's awesome. And I'm glad to see you wearing your foams. If I'm not mistaken, I saw your pictures today. I don't know if you got the follow-up and some of the things that you
I
sent.
don't think I got the email.
No, well, maybe let's check. You should be getting. Well, you should have gotten the 2 weeks one, and then you should be getting the 6 weeks one.
I replied to the 2-week one, but I didn't get like the link or anything.
Okay.
Like,
That's what I'm saying. I believe I saw yours, but checking your email a little bit later, because when we give you the reply, it takes sometimes a few hours for you to get it, and we included pictures to the we put the before and afters.
yeah, I've been having my massage lady take all my pictures because she likes to take before and afters for her own profile. So
That's amazing. That's great.
So
So listen to everybody listening. I think it's great that what you just said. First of all, when you send us pictures, which we will send you the links for you to know when to send us the pictures. Have, like she's doing, have somebody else take the pictures for you. Don't take it in the mirror. Don't take it as a selfie because it's really hard to get.
At home, it's just me and the little kid.
That's right.
But another woman I had met while I was down there in the hotel, we connected and she messaged me. She's like, "You're getting massages. Why don't you have the woman do them?" And I'm like, you know what? Perfect thinking. I'll ask her. So
That's right. Yeah, and the massage therapists that I'm teaching you there, like you said, they would love to see it because obviously they can see their progress too. And they can say, "Hey, look, when you started, you look like this, and then you look like this," and then shows off their work, and I think it's great. And then just make great idea. Thank you.
Yeah.
That's a great idea.
And then that was the thing too. I met some people while I was down there in the hotel. Connected people. It was nice to see other people around you. Going through the same thing. Sharing your stories. You felt a little bit more supported than just going home and not knowing anybody who's been through it. So
Yeah.
Well, you're part of a community, and that's always good.
Yes.
And I tell you something, in my kind of experience, sometimes when patients go to a recovery home, they have that community type of deal, but they lose complete privacy. In the hotel, you have both. You have your privacy, your hotel, your suite, which is very comfortable, and then you also have the community around it because you see the patients that are all, and they are going through the same things. So I think it's good because it's private, but at the same time, you can interact with other patients and get tips just like those. That's amazing.
Yeah, I agree. Those things were good. The transportation to the surgery. I don't even remember really getting. I was back at the hotel in the bed, kind of. And then I'm like, oh, everything's set up. My sister's here. Everything's set.
Yeah,
stress-free.
that's what we want, like, a lot of patients don't even remember getting out of the clinic, being transported. They remember that, wow, somehow magically appear back in their hotel room, and the surgery is done, and what happened, so that's what we really hope for, and it's,
Being a nurse myself too, once the drain met the threshold, I was like, yeah, I'm gonna remove this, okay. I had to just, take a deep breath, but like pretty painless. So,
All right.
yeah,
Good. So you
See?
removed it yourself.
I did.
Awesome.
I had a couple family members, they're like, you're crazy. Why would you do that? And I'm like, listen, I gave it like an extra day too to make sure it was truly like under the threshold. And I'm like, there's almost nothing draining. It's never going to be completely zero because you have some fluid. Like it's always going to have a little tiny bit. It's a strange feeling, coming across, and then got to the end and had to give it a little more oomph. But, if I can do it myself, then hey.
where can we get more patients like you?
I don't know. My belly button's looking pretty good. My massage lady, she keeps saying how well all my incisions are looking, So
That's awesome.
All right.
You're gonna have a fantastic result. Thank you so much for sharing your experience.
Thank you so much.
Yeah, keep up with the follow-ups, keep up with the pictures. We love to see
Yeah.
those, and
Thankfully, I really haven't had to, go back and forth and communicate. I haven't really had any complications.
that's awesome. That's awesome.
All right.
Yeah.
Congratulations.
Thank you so much.
You had a
Bye.
little one there. Thank you. Thank you very much.
Oh, yeah.
Bye.
The twins,
That's perfect.
Stay warm if it's still cold over there.
Bye-bye.
Bye.
Bye.
All right. Well, that's good. So, let's see. Can someone get abdominal etching with a tummy tuck?
You can, but in general, when we do the tummy tucks, we cannot do your abdominal edging, because we get access to the fat layer from inside. Instead of doing it from the outside, like with lipo, we get access from the inside. So we actually see. So we actually carve a lot of times the fat, especially like around your belly button, on the sides. We can carve that to give you that better kind of definition in those areas. So yeah, you do like edging, but you need to add it because we're doing it at the same time.
Yeah.
Right? I mean, how do you do it? But I think we do it pretty much the same way.
We do it the same way. You have to be careful. If you get too aggressive with liposuction and a tummy tuck, your risk of complication with the incision goes up. You have to remember that incision needs a good blood supply to heal. Liposuction can traumatize those vessels. So you want to have a balance. Sometimes the best way to do it is actually to get the tummy tuck, recover from it. It depends on your BMI and other factors, but then you recover from it and then come back and we can do more definition in a safer way. So it really depends.
Yeah, we are located in South Florida, in Fort Lauderdale, very close to Miami. For those of you that are asking, and they just found us. And yes, so no need to add extra edging when you're doing the tummy tuck with us. We'll definitely do the edging for you during the procedure. What else do you have?
Okay, so let's see. When can people start exercising?
We'll have everyone walk right after. It's very important that you start walking immediately after surgery. But if you're talking about exercise at the gym, then we always say 6 to 8 weeks. At that time, I think it's gonna be. I guess it depends on the procedure.
It depends on the procedure. If you have a tummy tuck, that requires the longest because you have a suture there that we need to protect. So there's no heavy lifting or any strenuous activity for 6 to 8 weeks. But for example, for liposuction, where there's no real suturing or maybe just a little incision, you can probably go back as soon as you feel like going back. And most people take about a week or two. Then you start slowly and build up some strength. So it depends, but anywhere between 2 to 6 weeks. So you mentioned cavitation as part of a recovery program for people that have some fibrosis, and they're asking what cavitation is.
There are a lot of different treatments that help with the fibrosis. There are treatments that do it with ultrasound. I think there are treatments that do it, like you were mentioning, with the CO2.
Yeah.
All these treatments, what they allow you to do is to work on that collagen remodeling that happens underneath your skin to get it softer. So any of these therapies will help you get a faster softening of your collagen to get a smoother skin results. At the beginning, sometimes the skin might look a little bit bumpy, but that goes away if the procedure was well done and you have good recovery after. Then that should be the way to go. But yeah, cavitation is just one of those.
Yeah. It's a little bit like physical therapy. So we
Yeah.
have some questions are being repeated, so I'm just going to repeat a couple of things for people that may have joined late. The best way to get prices on any procedure is to submit an online consultation. You go to the Top Aesthetics link or our personal link, our personal channels, Magic Surgeon or Real Dr. Angel, and you click on the link under our bio, and that's how you send an online consultation form with pictures. Then we send you your estimate, and that'll give you prices. That's number one. Number two, if you had a procedure and want to have another procedure, if it's in a different body area, then you can do it after 3 months. If it's in the same body area, like maybe you had a tummy tuck, now you want lipo or vice versa, then you need to wait 6 months to a year, and that'll depend how we see things on your pictures. But we keep getting those questions, and so we're gonna repeat that information. And now finally we have a question about Exparel. Is it helpful after lipo? Yes, it's helpful after.
It's a longer lasting local anesthetic. So the liposuction that we do includes local anesthetic. So we'll give you the local anesthetic, but the local anesthetic usually lasts about 2 hours to 6 hours. Now with the Exparel, your local anesthetics can last 48 to 72 hours, which is usually the most painful time, especially if you're considering massages and all that. So using Exparel will actually alleviate much better the pain after the lipo, especially if you're doing during the massages and so forth.
Now, it doesn't mean necessarily that you're not going to have any pain, but it's going to help. Actually, what studies show is that it basically cuts down your pain level in half. It cuts down your need for narcotic pain medication in half. So narcotic pain medication can cause side effects like headaches, nausea, vomiting. Some people, get confused or loopy or drowsy. All those side effects are also cut down in half because you're taking half of that medication because you took the Exparel. So it helps with any procedure. It can be applied in any part of your body. It's really worth it to have, again, just an overall better experience during your recovery.
Recovery length, usually thinking about, about 2 weeks for anything that requires liposuction, like a tummy tuck, also things like that. About 1 week if we're doing like a breast surgery alone, and about 2 to 3 weeks if you're doing combination of procedures. Combination of procedures might take a little bit longer, 2 to 3 weeks. And when I say recovery, I mean like going back to driving or doing like an office job or something like that. If it's something more physical, then thinking about 4 to 6 weeks. If you're doing about the gym, then it's 6 to 8 weeks. But usually in about 2 to 3 weeks, you should be able to do your normal life, except for exercise after pretty much any surgeries. Somebody was asking about keloids, how often the keloids happen. First of all, keloids is a condition pertinent to each patient. So in my experience, I would say that about 10% of the patients develop some sort of keloid scar. A lot of times it's not like something very severe. There might be an area that is keloidy. But no, it's not that frequent, to tell you the truth. Luckily, it's not that frequent.
It has to do also with genetics. If you've had bad scars or a keloid for something else, you may develop it, again. There's different things that can be done, steroid injections, but it's better if you know beforehand that you have that tendency.
Yeah, and we can always revise those scars and apply, Dr. Morales said, inject some steroids if it happens. So we keep close eye on that, and we keep good, follow up with our patients, so they shouldn't be afraid of that.
Okay, so one important question that I keep asking me through DM as well, if you did not add Exparel before the surgery, can you add it at last minute? Yes, you can. You can add a lot of things last minute. As a matter of fact, I always say to many patients that come and they're kind of worried because they gain weight, they want to do their chins or whatever, you can ask the doctor at the moment and you can add things at last moment too. We don't recommend it because it's better to have everything set, But if you have doubts, if you want to add something or the doctor recommends you something, you can add it at last minute. Guys, get Exparel. To everybody, I say get Exparel. It's not worth it to just say, you know what, my tolerance level of like pain is low, there's no problem. I wouldn't even risk it. You don't want to wake up from the surgery and have pain.
The only thing with the Exparel, we cannot give it to you later.
Exactly.
We can
You
only
just
give it to
can't.
you during
You
the
want to do
surgery,
that
so-
now. More if you're getting 2 procedures and more. Like, I wouldn't even hesitate it.
Yeah,
Listen,
yeah,
I'm getting Exparel in my nose when I get my nose job. I can do that, right?
You absolutely.
Does Exparel go to the nose?
Yeah. I mean,
Good.
it goes to anywhere that you can inject local anesthetic.
BBL and a rhinoplasty. I get a huge discount, maybe for free, and Exparel it in my nose. I can
We
sniff
said maybe.
this.
We said maybe.
Nothing is free. Might not cost you any money, but it won't be free.
All right. So,
Don't get confused.
do we recommend Lipo 360 with a tummy tuck?
Absolutely.
Yeah, it's a good. I mean, you're already there, and you're gonna get better definition of your waistline. You can get the brow rolls taken care of better. It's just going to add everything. You know, if you think about your torso, and it's gonna help you come down several sizes in your dresses and jeans.
When we do the lipo for chest tummy tucks, we usually do lipos of your flanks on these areas, the love handles. But when we do the lipo 360, we do lipo also of your back, and we can do even better lipo of your flanks. So I think it's definitely the best combination is to be able to do the 360 lipo and the tummy tuck. You know, so if you're having a tummy tuck, consider doing the 360 lipo. It's completely worth it.
All right, so we're up. Let's see, we have a couple of minutes.
Almost, huh? Almost reaching the hour.
Okay, so what? Okay, this is a good one. How much bigger is the incision between an extended tummy tuck and a regular tummy tuck? So we can actually talk about all of them. Mini tummy tuck, regular tummy tuck, extended tummy tuck, and then we'll just add in also like a circumferential, right?
Correct.
So let's start. So how big is the incision for a mini tummy tuck?
It depends on the size of the patient.
Yeah.
For the mini tummy tuck, you mean?
Mini, yeah.
Well, one of the things that I can tell you is that the mini tummy tuck the incision is not necessarily what's mini. You know, what's mini is the fact that we only remove the excess skin that is below the belly button, that does not include any muscle plication or muscle repair, that does not include a new belly button. So the incision will be as long as the amount of skin we have to remove. We just don't do a lot of the other things that we do on a traditional tummy tuck or above. You know, I think that's the main concept about mini tummy tucks. It's not the size of your incision, but you know, it's usually longer than a C-section.
Yeah.
It's usually
a little bit.
kind of a little bit shorter than a standard, maybe, you know, but it could be long as a standard. But you might not need the muscle repair, you might not need the umbilicus, so that's what we call a mini tummy tuck.
Okay.
What about standard?
Then standard. So again, that can vary, but typically it goes. We have a landmark in our hip. It's called the anterior superior iliac spine. It's a medical term, but if you can feel this little bony prominence on your lateral abdomen, and it goes from one to the other. So that would be the standard one. Extended, it goes beyond almost to the middle, like, you know, your axillary line. And then circumferential, obviously it goes all around. That's also called a belt lipectomy. So, you know, like Dr. Palladino says, it's not necessarily about the size of the incision, it's about what you do when you're there, if you're putting the muscles back together, how much skin you can resect, what you do with the belly button. Each incision, you know, each procedure allows us to do more for patients that are bigger or have more excess skin. But in general, that's how we, you know, differentiate each procedure.
So one of the questions is, what kind of surgeons are we? We are cosmetic surgeons. We do cosmetic surgery. And another question from Angela is if we can fix hernias at the time that we're doing tummy tucks.
Yes, actually that's the best way and the best time to fix it, because you already are there, you have it all exposed. It's part of the procedure when you're putting the muscles back together. The same suture line corrects those hernias, so it's already there, and it's a great way to fix it, and a great reason to get a tummy tuck.
By the way, we are both general surgeons too, and we train together when we're doing general surgery. So we are experienced hernia surgeons. We have been involved in many cases that we have done very significant, massive abdominal wall reconstructions and hernia repairs. And the very best way to fix a hernia is during the tummy tuck. Because usually in general surgery, you do something to reinforce the abdominal wall, like you put a mesh or you put something external, because they're not plastic surgeons, but the plastic surgeons like we, the cosmetic surgeons like we are able to reinforce the abdominal wall without necessarily using a mesh and using your own tissues. During the muscle repair, we are reinforcing the repair of your hernia too, so it doesn't come back, which is something. Now you should put on your side like lose weight, don't gain weight, to avoid the chances of coming back.
So there's
Thanks,
only
Essie.
2 minutes left. Hi, it's me again. Only 2 minutes left. And I want to say for all the people that have a lot of questions that are very curious and have not been answered, because today there was a lot of people connected. We are in 4 platforms right now. Amazing job, everybody, like asking question. I feel really bad. They too, that we cannot respond to everything. Any questions of these types that you have, you can always send it to DM. Through DM, we always respond to everything. And of course, we're not doctors, the ones that respond through DM. But if we have a curiosity that we don't know, we ask the doctors and then we respond to you. So feel free to do that. And if everybody wants to vote for my rhinoplasty and BBL to get 75% off, you guys, I'm on it, okay?
75.
Listen, I need a discount. Look at this.
Yeah.
I need a big discount because
No.
there's a lot of work to be done there.
We're gonna vote too. We vote too.
You'll be surprised. It's harder when you are skinnier,
You think I'm so skinny. No,
Yeah.
I'm not that skinny, doctor.
Gavin,
Hi.
hello.
I have a question for Tummy Tuck. I don't know.
Yeah, absolutely.
Go, show us.
Well, I have to tippy toe here.
Good, good.
I have a scar.
Okay, yeah.
I had a wound back on my stomach.
Okay.
Go a little bit further back so we can see better.
Yeah, we can see it's from your belly button down.
Yes.
Yeah. Yeah, perfect candidate for a tummy tuck to remove that scar.
And would I would need an extended tummy tuck?
Yeah, absolutely.
And like 360?
Yeah, that would be awesome. Yeah, that will get you better the waistline. I think.
Well, let me ask you something real quick. What's your height and weight?
I'm 4'11",
Yeah, wait a
and my
bit.
weight is 150.
No, they're doing this.
No, I know they're putting that right now.
Sorry. 4'11" and what?
150?
Okay. Yeah.
You are barely just at the 30 BMI type. If you can lose more weight, it's gonna be even better.
I work out almost every day.
Awesome. But yeah, you could definitely do an extended tummy tuck, and that will remove completely the vertical scar that you have.
Yeah, 'cause
You know?
I have this one and then I have another one right
And-
under it.
Yeah.
Well,
It'll take care of both and all the extra skin.
have you had kids before?
Yes, I have 2.
Very good. No more?
No more.
Then.
This is how this happened. I tied my tubes and my spleen got lacerated.
Oh my God.
Yeah, they removed my spleen through here because I had emergency surgery. So like this would never be muscle.
Right.
Emergency surgery, they tore me open.
Well.
Well, it's good that you
Yeah.
are doing better, and this can all be corrected. So
Yeah,
Yes.
you're gonna look good. Lose a little more weight if you can, but then definitely you're an amazing candidate for the 360 lipo and the tummy tuck.
Okay, awesome. Thank you.
You're
Bye.
very welcome. Thank you for tuning.
all right. Well, it's 6:02, and I think we are going to say goodbye.
Yes. How long have you been surgeons, and what was your first operation like?
It was since 2009, right? Right?
Well,
8
I
or
mean,
9?
what do you count? When we started the training, when we finished the training?
Yeah, I guess it depends.
Yeah.
Um,
Well, we started doing surgeries both like around 2003,
yeah,
right?
2003.
And I don't know, what was your first operation? You remember?
It also, it went fine. Otherwise, I wouldn't be here. No. No. What was it? I can't remember. You start with small things,
Yeah.
know. So it was.
Like a hernia, maybe
Uh-huh.
like an inguinal hernia or something like
Something
that.
like
I think
that.
it was something like that. Yeah, maybe like a cyst removal. You're always assisting at the beginning too. You're not. So until the later, I remember. I'll tell you this story. I remember the first time I helped my my chief's, the chief's resident close, and he closed one side of the breast, and I closed the other side of the breast, and then he finished his side, and he looked at my side, and I was like 1/4, and he looks at me and he says, "Muy feo." Very ugly.
That's a bad
So,
experience for being a newbie.
Yeah, but these guys were amazing, and they teach you everything. And luckily, because we had amazing buddies and residents ahead of us, now our incisions are muy lindas.
Listen, if you want, you can still practice on my body.
Yeah, we
I
will.
don't have to pay you anything. You can use me as a lab rat. All right,
Everyone,
guys.
All right.
Have a great
Thank you for tuning
night,
in.
time. We'll do it again very soon. And if you have questions that we couldn't answer, just
DM us, and
Yeah.
we'll get right away. But we'll get back to you right away.
Now we're gonna get out of these multiple platforms.
Yes. Thank
Bye.
you.
Adios.
Bye.
Bye bye.